If breastfeeding is painful, the problem is usually the latch, not your body. A deep latch is the foundation of comfortable breastfeeding and good milk transfer. Here's how to get it right. First, position your baby so their nose is lined up with your nipple, not their mouth. This encourages them to tilt their head back slightly. Next, wait for a wide open mouth, like a yawn. Be patient. When their mouth opens wide, quickly bring your baby to your breast. Do not lean your breast toward the baby. Bring baby to you. Their chin should touch your breast first. Their lips should be flanged outward, like fish lips. You should see more areola above the top lip than below the bottom lip. You should feel pulling and pressure, but not sharp pain. If it hurts beyond the first few seconds, gently insert a clean finger into the corner of their mouth to break the seal and try again. A deep latch protects your nipples, helps baby get more milk, and prevents many common breastfeeding problems.